All right, it's just after 7 o'clock, so we're going to go ahead and get started. Welcome everyone to tonight's presentation. I do see a lot of new folks on the webinar tonight, and I do see some familiar folks. But for those of you who are new or who are returning, our company is called Parco. It stands for Pension America's Retirement Company, and we do retirement and financial planning for anybody with a pension, but especially government employees. And we work with government employees across the country and around the world, no matter what stage of their career that they're in, helping them plan out all the different things that they could need to consider as they want to make sure they make the most of their financial futures. And really, at its heart, we try to take all the uncertainty and complexity that can come with all the things you need to consider as a federal employee, as a retiree, and as an American, and make it simple, clear, and focused all in one easy place to understand. And nothing I think is perhaps more complicated and more worrisome for folks than health insurance. I mean, this has been in the news for a lot over the past several weeks. Open season is upon us. And so we wanted to spend tonight's presentation going through FEHB and health insurance, some basics and what to think about and how to plan. So we'll talk about some basics that involve health insurance. Like a lot of you, I think, might know this, but for some folks, it might be an important refresher on some key terms. Then we'll talk about federal employee health benefits or FEHB. Then we'll talk about Medicare. We'll talk about how FEHB and Medicare tend to work together. Then we'll go through some FAQs and how to get started. And for those of you who maybe were able to join us last week when we did this presentation previously, we got a lot of really good feedback and a lot of questions. So we've enhanced the presentation tonight based on the feedback and the questions we had last week. So we do always listen. So let's talk about some of the basics around health insurance. Now, in the United States, most people get their health insurance from their employer. And this actually, the history of this is relatively interesting because it was actually kind of uncommon up until the 40s and the 30s and the 40s when there were price controls during the Great Depression. And a way to get around wage and price controls, um, employers started offering benefits through work. And one of the benefits they offered through work was health insurance. And that just kind of stuck. So in the United States, almost half of folks get their health insurance from their employer. Then a good chunk of folks are on Medicare and Medicaid. Then there's people that are in the VA, and then there's folks that are uninsured, and then they're in private coverage. So as a federal employee and then as a retiree, that's an employer sponsored plan. So when you have your health insurance through an employer, you pay a premium, but then your employer also pays a portion of the premiums. Now, we'll talk about this a couple times tonight, but it's worth mentioning now. One of the coolest things about being a federal retiree is that you guys get to keep your health insurance with you in retirement, and the portion that your employer pays continues into retirement. That is very, very unusual. And it's a huge benefit. And it's a part of the reason why a lot of folks work for the federal government is to have that healthcare certainty in retirement. So now let's talk about some of the key terms as it relates to health insurance. First is your premium. So this is how much you pay per month or per pay period toward your health insurance. That's how much it costs. Then there's your deductible. This is the amount that you must pay out of pocket each year before your insurance company begins to pay for covered services. Co-payments are fixed fees that you pay for specific services, like a doctor's visit, prescriptions, things like this. These co-pays count toward your deductible. Co-insurance is the percentage of costs that you share with your insurer after meeting your deductible up to your out-of-pocket maximum. So it depends on the procedure, depends on the thing that you need. There might be a co-insurance element. Your out-of-pocket maximum, this is really important, is the total amount you'll pay in a year, including deductibles, copays, and co-insurance. After reaching this out-of-pocket max, the insurer covers 100% of covered expenses. The network is the group of doctors or hospitals or providers that are contracted with your insurer. So using in-network providers usually costs much less than using someone that's out of network. So a lot of folks will choose their health insurance based on the doctor that they see. Or conversely, they'll see a certain doctor um, they'll see a certain doctor because they're covered under their health insurance. And I know I didn't mention this during the uh, intro. If you do have questions, you can ask them in the question and answer window. You can also ask them in the chat window in the Zoom call. So, covered services are medical services and treatments that are covered under your health insurance plan. This usually includes things like preventative care, hospitalizations, prescriptions, maternity care, mental health services, things like that. But then there are also things that are excluded or limited. So, generally, things like cosmetic procedures and experimental treatments might not be included by your health insurance. Then there's prescription drug coverage. So, this will tell you what prescription drugs your health insurer will cover and how much it'll cost depending on the tier of drug that you need. And then there might also be, depending on your health insurer, provider access rule that might require you to get a referral to see a specialist or pre-authorization before you get certain treatments, things like that. And that varies from insurer to insurer. So we've just gone through a lot of terms, but let's kind of walk through an example to see how health insurance works. So let's say you're enrolled in Blue Cross Blue Shield Basic, so the basic plan offered by Blue Cross to federal employees. Very, very common. Code 111 for single people, for self only. Your premium is $1,377 per pay period. So some of the plan details. It has no deductible. Their copays for primary care are $35. There's different costs for prescriptions. Your inpatient copay for a doctor's, like if you're at the hospital, is $200. For a hospital visit, it's $450. And then your out of pocket maximum is $7,500. So let's say you have a normal year where you go to the doctor 3 times, you have 2 monthly tier one prescriptions. So you pay $105 in copays, you pay $360 for prescription drugs, and so your total out of pocket is $465. Now, premiums don't count toward your out of pocket. So your total premiums paid is $3,478 for total healthcare costs $943 for that year. Now let's say there's a year where you need to get a back surgery. And let's say that back surgery costs $24,000. Maybe you go see the doctor a few more times and you need to get those same prescriptions. But maybe you need another prescription because of your back surgery. And then when you go in for the procedure, let's say you need to have a doctor there, so that costs you $200 plus the hospital inpatient copay of $450. So your out-of-pocket costs initially are $4,245. But the hospital bills you for the balance. You have your out-of-pocket max of $7,500, so they max you out to $3,255. So that, with all of your premiums, mean that premiums plus out-of-pocket expenses totals almost $11,000. So we wanted to kind of spend this time illustrating how these different levers move together. Now let's talk about your federal healthcare in more detail. So FEHB is very affordable health insurance. It's perhaps, I won't say it's the most valuable benefit you have as a federal retiree because your pension's obviously worth a whole lot. But the fact, aside from running out of money, it's funny, we did this on a webinar a few weeks ago. Allianz, the big insurer, said that the number one concern for people, for Americans, when it comes to retirement is whether or not they're going to run out of money or outlive their money. But the second biggest thing is what they're going to do about health insurance. For federal employees, since you have a pension, since you have these other benefits, that first concern I just mentioned about the running out of money is a whole lot easier to talk about. And we've detailed that in past presentations. But then this FEHB component is also way less stressful because you get to keep it in retirement. And the price stays the same for federal employees as retirees, meaning that if you're enrolled in Blue Cross Blue Shield Basic and you're 64 years old and you live in Maryland, and down the street from you, there's a 38-year-old who's enrolled in Blue Cross Blue Shield and lives in Maryland, you guys are paying the same rate, even though one's retired and one's still working. That's awesome. That's awesome. And within FEHB itself, there's a bunch of different insurance providers, places like GEHA, United Healthcare, Aetna, Cigna, all these different health insurance providers. It varies from state to state. And so For FEHB plans, kind of on average, you receive effectively a 70% subsidy. So what does this mean? This means that when you're paying premiums per pay period and you see how much it's costing you, just know that for every dollar you're putting in, basically, the government is putting in uh, almost two and a half more dollars because they're basically subsidizing you by 70%. So that is really powerful. Really, really, really powerful. Now, health insurance costs for everybody in the country have been going up for a long time. Last year, so from 2024 to 2025, premiums went up on average 13.5%. This year, on average, they're going up just over 12%. So they do get, it has been getting more expensive over time. Now, that's all about FEHB. Then there's something called Medicare. So Medicare is a big health insurance plan run by the government. And there's four main types. There's Part A, Part B, Part C, and Part D. So we'll go into each of these in detail. But Part A covers hospitalizations, it's free. Part B is also known as general Medicare. This covers copays, durable medical equipment, and general insurance. It's your general insurance. Part C are private alternatives to Part A and B. And then Medicare Part D covers drugs. So Medicare Part A, if you ever look at your paycheck and you see a deduction coming out of your paycheck for Medicare, this is paying for Part A. So it covers hospitalizations. It's free if you have 40 quarters paid in. And we always recommend when you become eligible to turn on Part A, turn it on. So when you turn 65, just turn on Medicare Part A. It covers hospitalizations. Medicare Part B is general Medicare or Medicare insurance or medical insurance. It is optional. The base premium is two for 2026 is going to be $206.50 per month. This covers outpatient, doctor's visits, medical equipment, things like that. We're going to talk more about Medicare Part B in just a minute. Medicare Part C or Medicare Advantage is basically like a private alternative to A, B, and C. Most federal employees don't need to think about getting Medicare Part C because they have FEHB and they have Medicare. But for a lot of private sector folks, maybe they think Medicare Part C can make sense because they like the benefits of the plan that's offered. There are hundreds of Medicare Part C plans. I'm sure many of you have been inundated with phone calls from folks trying to sell you Medicare Part C. In general, you can ignore those. And then there's Medicare Part D. This covers prescription drugs. Um, so this covers drugs. Again, federal employees don't have to worry so much about Medicare Part D because your FEHB plan has to have a Medicare Part D compliant prescription plan built within it. So Medicare and FEHB tend to work really well together, and we're going to talk about that during a whole section here in just a minute. Now, there are some really important things that Medicare doesn't cover. It doesn't cover things like hearing aids, your annual physicals, routine foot care, podiatry, medical, dental care, overseas care. Those are things that Medicare really won't cover. Now, to participate in Medicare, or to use your Medicare, I guess I should say, your provider, your health insurance, or your doctor, whoever's your provider of your care, needs to accept Medicare. So they have to accept the Medicare approved payment for whatever services they're rendering. So that's why that's so important. Is that a lot of folks only want to go see a doctor that will accept their Medicare. Now, during our last presentation, we were talking about Medicare and we were talking about premiums, and there were several questions about something called IRMA. IRMA stands for the Income Related Monthly Adjustment Amount. So this basically states that if you make more than a certain amount of money, you have to pay more in Medicare Part B premiums. That the base that they use to evaluate your IRMA, if you're going to have to pay a higher Medicare Part B premium, is based on something called your modified adjusted gross income. So IRMA is an income related monthly adjustment amount. It's an extra premium you have to pay for Medicare Part B and Part D, especially if you're a high earner. And they will look back to your MAGI, your modified adjusted gross income, for 2 years to calculate whether or not you owe it or not. So, what is MAGI and how is it different than AGI? So, MAGI is your modified adjusted gross income. So, it's your AGI, your adjusted gross income, plus add backs that show your true income amount for these calculations. So, your adjusted gross income is what is used to pay your federal taxes, what they use to calculate how much you owe in federal taxes. Your MAGI includes that, but then they add back things like your non taxable Social Security benefits. Recall that for many, a large portion of your Social Security is exempt from taxation. So MAGI adds that back. It also adds back tax exempt interest. So let's say that you have a holding in a bond that's maybe like a municipal bond that gets tax free interest. They'll add that interest back. Also, let's say you earned income abroad, they add that back as well. So for 2026, I think you guys might find this a pretty interesting graphic here. Here's what the IRMA brackets are. So if you're a single individual and make less than have a MAGI of less than $109,000, your Medicare Part B premium is $206.50. If it's between 209 and 137, your Medicare Part B premium would be 289.10. Between 137 and 171, 413. 171 to 205, 536. It goes up again. People making between 205 and 500K to 660. And if you make more than $500,000 as a single individual, and you're enrolled in Medicare Part B, you have to be enrolled in it. Your Medicare Part B premiums based on the IRMA will be $702 a month. If you're married, the brackets are scale very similarly. So hopefully this is a helpful way to kind of understand how that works. So as a little example, let's say that your adjusted gross income for the year was $100,000. And then you also had tax exempt municipal bond interest of $5,000. Your MAGI would actually be $105,000. Now, fortunately, this person in this example is below the IRMA requirement. But let's say they had an AGI of 105,000 and their tax exempt mutual fund interest was or mutual bond interest was 5,000 and they were making 110 on a MAGI basis, their Medicare Part B premiums would go up over $80 uh, per month. So something to keep in mind. Now let's talk about FEHB and Medicare together. So when you have FEHB and Medicare together in retirement, Medicare becomes your primary payer and FEHB becomes your secondary payer. Now, we always recommend that you read your plan material because because we'll talk to folks and they'll say, "Oh, well, I'm not going to enroll in Medicare," even though I could. You can technically do that, but many plans will basically require you to enroll in Medicare because they'll say something like, "We will only pay what Medicare would have paid," and so one of those things you also want to be really careful about private contracts, where if you do, Medicare may not cover a service. It's one of those things that we always like to point out. On top of that, FEHB's drug coverage is really comprehensive. And so, what does that mean? It means that you generally don't need to pick up Medicare Part D as a federal retiree because your FEHB plan plus Medicare Part B will cover whatever needs you have for any prescriptions. Because Part A and Part B together are the original Medicare. Um, on top of that, many FEHB plans will waive things like your annual deductibles, co-payments, co-insurance if you are enrolled in original Medicare. So I always think that the easiest way to think of things is by way of example. So let's say that you need to get a hip replacement and you are enrolled in Medicare Part A and B plus FEHB. So let's say you're enrolled in Blue Cross Blue Shield Basic. So your premiums are $289.84 a month, and then for Medicare Part B, it's $206.50 a month. So you're paying both of those together per year. But then but then Blue Cross Blue Shield Basic also offers an $800 reimbursement for your Medicare Part B premiums. They're one of the plans for reimbursement for a portion of your Medicare Part B premiums. So Your net premiums for the year are just over $5,100. Now, let's say you need a hip replacement, and a hip replacement costs $40,000. Well, Medicare will pick up the first 80%, then the remaining 20% will be picked up by Blue Cross. So the amount that you'll have to pay is zero. And so your total healthcare expenditures, remember how we said that enrolling in both really minimizes your out of pocket, would cost you about $5,156 per year. So it's not nothing, certainly, but you know what that amount's going to be. It's basically fixed. If you only had FEHB, your monthly premiums are definitely lower. However, if you had to get that hip replaced, Blue Cross would only pick up whatever Medicare would have picked up, so that 80%. So there's $8,000 left. So you're basically on the hook to pick up 8,000 or your out of pocket max, whichever is less. So your out of pocket max is 7,500. So your total health care expenditures, premium plus out of pocket, would be almost $11,000. So that's why we almost always recommend folks pick up Part A, Part B, and keep their FEHB in retirement to make the planning way smoother. So, especially if you're worried about high out of pocket costs and you want the certainty about how much your healthcare will cost in a given year, picking up both of them makes a heck of a lot of sense. So, now let's go through some frequently asked questions. So, people ask, and there's going to be a few of these. Can I change my healthcare plan in retirement? Yes, you can change your FEHB during open season, even in retirement. This is super powerful, right? This means that let's say you live in California and you're enrolled in a Kaiser plan, and then you move to Florida and maybe Kaiser's not as strong there, uh, and instead you want to enroll in Blue Cross. Well, during open season, you can shift it. That's really really unusual, and a huge benefit for you. Can my spouse stay on my FEHB in retirement? Yes. So long as you have access to FEHB, your spouse can access FEHB as well. Should I drop FEHB and just do Medicare? Depends, but this depends. But most people elect to keep FEHB and pick up Medicare to minimize out-of-pocket expenses. What about the FEHB 5-year rule? So what this person's asking about is with FEHB to maintain coverage into retirement, you need to have been enrolled in FEHB for five continuous years before you retire. So to keep access to the FEHB, you want to make sure that you're enrolled in FEHB for 5 straight years before you retire. We've actually worked with a few folks that, for differing reasons, dropped their FEHB and now are basically trying to restart their clock for their 5-year rule. And it's taking them, they're actually having to work a couple extra years just to make sure they get to keep that FEHB in retirement. Another question: how long do I have to enroll in Medicare after turning 65 and retiring? The answer is 8 months. So after you've retired or turned 65, whichever happens second, you have 8 months to enroll in Medicare. What if you retired and didn't enroll in Part B, but would like to now for the added benefits? Are there any penalties or are there any problems with that? You can do so now. However, you'd also have to pay a late enrollment penalty of 10% per year. There's another question. Do I need Medicare if I'm enrolled in TRICARE for Life? So veterans have access to something called TRICARE for Life, which is kind of like a FEHB for veterans. So to enroll and to use TRICARE for Life, a veteran must be enrolled in both Medicare Part A and Part B when they become eligible. That's part of the rules. What about if you're still working? How long after you retire should you enroll in Medicare Part B? So we get this question all the time where somebody says, "Hey, I just turned 65 or I'm 66 and I haven't enrolled in Medicare. What's going to happen?" Well, as long as you're still working for the government, you fall under what's called the large employer group waiver, which says that you don't have to enroll in Medicare until you retire. And so because of that, once you do retire, whenever that happens, at 65, 66, 67, you can enroll in Medicare up to 8 months after you separate, and there will not be any penalties against you. This grace period applies to veterans as well with TRICARE for Life. I have an FSA or a flexible savings account. Does this roll over each year or in retirement? No, FSA funds do not roll over. They're use or lose. Are my FEHB premiums paid during the government shutdown? They are. FEHB premiums are paid during a shutdown, and you do not lose access to health insurance or care. If you change your FEHB plan during open season, when will the change take effect? If we do so during this open season. The change usually takes effect in the first pay period in January of next year. So if you would change your health insurance plan this month, that change will take effect in January. How do I enroll in Medicare? Um, no, that is not the answer that I wanted to have there. How do I enroll in Medicare? You go to the best answer to that is to go to ssa.gov and you enroll in Medicare on a Social Security's website. So now let's talk about how to get started. So we know there's a whole lot to consider here. We know we've gone through a whole lot tonight. So first thing we would recommend is go to goparco.com. There you can create your account. You just click login or sign in or create account and begin some of the planning on your own. And then throughout that process, you can always set a time to talk to one of our teammates because look, we know these things are complicated. We know there's a lot to consider. And it's one of the things we help folks work with every single day. So I do see a lot of questions in the Q&A window. So I'm going to open it up now. So please ask those. And if there's any other ones you have, please let us know. We're here to be helpful. And we know that there's government shutdown potentially ending right now. So we're all kind of keeping uh, look just to see what the status of all that is. So hopefully you're finding this all helpful and we're looking forward to answering any questions that you have. Say I decide to retire at 59, when do I have to enroll in Medicare? At 65 or sooner? It's a great question. So if you retire at 59, uh, you should enroll in Medicare. Now, we usually recommend folks apply about 2 months before they turn 65. That gives it time to kick in. Thank you. Okay, so there's a question from Rosa uh, about do I have to have a survivor benefit plan for the spouse to have access to FEHB? So technically, you don't have to have a survivor benefit for your spouse to have access. However, if you were to die and you didn't elect a survivor benefit, your spouse would lose access to the federal health care. So they'd always have access to it while you're alive. But if you didn't elect a survivor benefit, they would lose that coverage if you passed away. So I just wanted to be really explicit on that. There's another question. How does Medicare, FEHB, and the VA all work together, or do they? So, uh, Benita, I need a little bit more clarity on your question there. But it sounds like you might be enrolled in FEHB, you might be enrolled in TRICARE, and you might be also thinking about Medicare. So, for those who are veterans and who maybe have access to TRICARE, but then also have FEHB through their government job, we there's this kind of cool strategy called an FEHB suspension, where basically you can suspend your FEHB coverage upon retiring. So you don't lose access to it. You basically say, hey, look, I want to pause my FEHB. And then you usually people just do Medicare and TRICARE. And what the reason why they'll do the suspension is that if something changes, let's say the rules change or your medical needs change or you move or you're far away from a VA or there's places that you go to that don't take TRICARE or it could be anything. You've left yourself open the optionality to um, to re-enroll in FEHB during open season. So I hope that was helpful. Oh, you have access to the VA. Okay. So just sometimes for folks that do make use of the VA, it can also just really depend on like the quality of the VAs that they visit. Um, Could you see some more Q&A here? Another question. How can I tell whether switching from Blue Cross Blue Shield standard to basic will be advantageous if I have Medicare Part A and B, other than the $800 payment? Well, it can also mean lower premiums. Uh, and I guess it also just depends on your doctor and what type of places you have to go for healthcare. Um, but generally, I will say that most folks, once they get to Medicare age, do switch out of that standard plan to the basic. Um, you can also, if you look through the plan documents, there's a lot of good resources on the OPM portal. You can do like a side by side because there's all kinds of different permutations there. Hopefully, that was helpful. Da, da, da. Tim, I see your question there, but would you mind clarifying it? Lori says, did I understand you correctly that when you said that we should not consider Medicare Advantage plans? If so, why not? So generally what we see is that the Medicare Advantage plans, those Part C, those are private alternatives to Medicare Part B and Part D. And generally, like the pricing of them and the coverage that they provide is not competitive or comprehensive compared to Medicare Part B plus FEHB. So just like what you get for the price tends not to be very attractive. Um, Now, for regular Americans who don't have access to FEHB in retirement, um, it can make sense for them. But for those who have access to FEHB that has such that big subsidy, um, it just tends not to make a lot of sense. All right, let's see here. I'm trying to answer everybody's questions here, so just give me one second. Oh, good question. So Ray asked if you're a federal employee and then retiree with FEHB coverage and you go back to work for a non-federal employer, can you keep the FEHB? Absolutely. In fact, we sometimes recommend that folks use it as a negotiating tactic or a negotiating point because if you're an employee and you say, hey, look, I don't need to participate in your employer healthcare, that's a big savings for your employer. Maybe they'll pay you more. So you can definitely do that. We have lots of folks who do that. Great question. So Thomas asks, could it make sense for spouses on the same federal health benefits plan to make different choices on Medicare Part B, say if their health conditions were different? I generally don't see that happen very often. Because the challenging thing with health insurance and a lot of these things is that you're also trying to insure against that big surprise bill. And so I'm sure there could be a situation where like you're really healthy and maybe your spouse isn't. So you just say, hey, well, honey, you go on to Medicare Part B and I'm not going to. I'm just going to kind of roll the dice. You couldn't do that. And there's certainly situations where if you looked at it, people would have been better off doing A or B, or doing one versus the other. But when we're trying to give like, broad advice that leads to the best outcomes. Generally, we see folks enroll in Medicare Part A and Part B when they become eligible. Okay. Do I need FEHB after retirement if I have TRICARE for life through my spouse? That's a great question. This for you, Rebecca, I would recommend doing the FEHB suspension path. I would keep your FEHB, but then tell them you want to suspend it. There's an FEHB suspension form, and then stay on your spouse's TRICARE. Enroll in Medicare Part B when you need to, but you at least give yourself always the option to enroll in FEHB if you need to. And it doesn't cost you anything to secure that option. So Mr. Young asks, if you sign up for Medicare Part B and are under IRMA because you're considered a high earner based on MAGI, once you retire and your income goes down to the standard IRMA, does your Part B premium decrease? It does. So there will be a lag on it because they do a 2-year look back, but once it does decrease, your premiums will decrease as well. Great question. Okay. My spouse is covered under my FEHB and we both are working for the federal government. If I stop working at 65 and my spouse still continues to work, do I or him need to enroll in Medicare Part B? So we would recommend that you, the retiring federal employee who is past age 65, enroll in Medicare Part B. Your spouse, however, could wait until they retired to then enroll. Right. So Sheila asked a question about how do I find out if I have dental and vision for my federal service. If you're retired, you would be able to see that on your services online portal from OPM. You would see that be as a deduction coming out of your pension. You also, uh, if you're enrolled in dental and vision, you'd likely also be getting plan documents or a member card as well. I'm getting through everybody's questions, so keep them coming. I am currently enrolled in a Medicare A and B plan with FEHB. If I opt out of FEHB for another plan, then may I re-enroll the next open enrollment? So, Carolyn, I'd ask you to kind of like give a little bit more details there, but if you opt out for another plan, is it still a federal healthcare plan or is it something else? The answer to that would be different. Yes, Kirk, thank you. The suspension. Da, da, da. Does each spouse need to pay for Medicare Part B when they retire, though one is covered under another one, FEHB? So let's say I'm just kind of like reiterating my answer to your previous question. Let's say that you retire at age 65 and your spouse, you both work for the federal government, you retire at 65, your spouse is still working. When you retire, you should enroll in Medicare Part B and you're covered under their health insurance plan, or you could keep your own. Then when your spouse retires, they'll get to keep the FEHB, but then they have to enroll in their own Medicare plan as well. Because Medicare is like individual. The premiums are based on the individual coverage. So Paul asks, how is the Part B penalty calculated? So it's based on it goes up basically it increases the Medicare Part B premiums that you'd have to pay per month in perpetuity by 10% for every year that you didn't take Part B when you otherwise could have. So you can almost think of it as like a penalty for not having enrolled or not having it paid premiums when you otherwise could have. So for every year that you wait to turn on Medicare Part B when you otherwise would be eligible to turn it on. So let's say you're retired and you're covered or you're past age 65, the Medicare Part B premiums that you will have to pay when you re-enroll will be 10% higher. And I believe they compound it. So if you waited 2 years, it'd be 110% times 110%. So whatever that is, be a 20, what is it, 21.2% increase from base. Something else. So Carolyn, I would be really careful about moving out of FEHB, especially if you're past age 65, and then trying to come back in because you would then be violating the 5-year rule and you wouldn't be able to keep that health care in retirement. And if you'd like us to talk about that one-on-one, you can either set an appointment on goparco.com or send us an email, or Lauren can reach out to you right now individually and set a time. Um, to go through that because that'd be really, really important to make sure we get right. Claudia asks, I plan to retire and move overseas as I understand that Part B is not valid overseas. Only FEHB overseas coverage provide coverage needed. There are a lot of federal healthcare plans that will provide coverage for folks overseas. We know a lot of folks are on like the Foreign Service Healthcare Plan for that reason. So that's a little bit of a complex question because you'll have to like research where you're living and like, there, there's a whole lot of permutations there. Um, but you're correct. Medicare won't cover others over cover won't cover overseas treatment. So you want to make sure you're enrolled in a FEHB plan that does. Da, 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 da. All right, now I'm going to go to the Q&A section here. What are the advantages of Blue Cross Blue Shield Blue Focus? I'm not as familiar with that plan, so I can't really comment on that one individually. Um, and again, a lot of these things really depend on your specific health insurance needs and what doctors you need to see and things like that. Um, we're more fluent in things like Blue Cross Blue Shield one, the basic one, just because it's so common. Um, da, da, da. Rudia asks, do you have any offices in Maryland for one-on-one session? We do almost all of our meetings virtually. So if you set an appointment, we talk to folks, across the country and around the world. We did a presentation for some folks in Germany a few weeks back, all over Google Meet or Zoom or Microsoft Teams or whichever platform you prefer. Um, um, all right. EHA has a Medicare Advantage that works with A and B. It kicks back money out, but it's called an MA. Do you need to suspend FEHB? Tim, I wish I could answer. I'm not as fluent in that plan, and so I don't want to give you the wrong answer. If you shoot us an email, or Lauren can reach out to you individually at info@goparco.com, I can work on chasing down an answer for you, but I don't want to give you an inaccurate one tonight. Keep those questions coming. Hopefully, you're all finding this helpful and informative. I know it's a lot to go through. Um, I'm also going to put the poll out here in just a second for some next topics. Um, so if you give me just 1 second. Um, let me get this launched here. Okay. All right, and let's get this sent here. All right, and I'm going to send out a poll really quick so that way you guys can give us ideas for our next presentation. All right. Hopefully you guys can see that now. So if there's other topics you'd like us to cover, we'll certainly be incorporating as well um, uh, the feedback that you had in the Q&A for the next one as well. All right, hold on. There's some more questions coming in. All right, let's see here. I retired from federal service and continued my FEHB and covered my retired spouse who's 63. I started Medicare Part A and Part B at 65. Does it make financial sense to have both FEHB and Part B? Generally, we see people say that it does make sense to do both. Um, we do see folks say it makes sense to do both because they're really limiting their out of pocket expenses. We know it can be expensive on a monthly basis, right? It's an extra premium. However, it's one of those things where people like to have the certainty of how much they're paying. There's another question. Do we get to watch your earlier recorded topics on your website? So you can access them on our website. It's actually easiest to find them on our YouTube channel. And so this webinar will be uploaded to our YouTube channel tonight. If you send us an email, I can send you a link to that YouTube channel as well. We just redid the goparco.com website, and we're making it more performant every day so that way it'll have more of these resources available to you. That's a great question. Da, 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 da. There's another question. Can I ask what minimum investment Parco will manage for a client? We really don't. We're not like most financial firms where we have a minimum amount that we'll invest or manage for a client. Um, so we really don't have any minimums. Um, when we enroll in dental or vision plan, do they give a coverage brochure? They should. They should. Those are also generally pretty easy to access online as well. So if you're looking at the dental and vision plans, you can also get a lot of that information from the web. And I just launched that poll as well. And if there's a topic, we pulled about a few different topics, but if there's a topic that's not listed that you're like, hey, we got to pound the table. I really want this one covered. Please say that in the chat or in the Q&A window here. Um, this FEHB presentation that we've put together that we went through tonight is one just like that, um, because people were asking for it. We did another one about rifts and government shutdowns. We will likely have to do another one of those. So please keep those coming. We've even had some folks ask us about lately about gold and Bitcoin. So, uh, the whole idea from these webinars that we've been doing now is really to make this informative for you all as possible, um, and specific and valuable. So you actually get the questions answered that you want, that it's not just something generic. Um, so hopefully you're finding this all very helpful. All right, I'm going to stick around for a few more minutes to let any other questions that are coming in come in. Thank you for the compliment. Great question. So we do a webinar. There's a question about do we have a schedule of upcoming webinars? We do a webinar every Wednesday night, almost every Wednesday night. Next Wednesday we're actually traveling, so we're not. And we'll start having our webinar schedule, our calendar on our website very, very, very soon. Hopefully tomorrow. Um, so they'll always be coming. Thank you all for the compliments. Hopefully you all are sticking through it, and I know this government shutdown's been very difficult for many folks. Um, so hopefully we're seeing light at the end of the tunnel there. Um, and our goal here at Parco is to make this all as easy as possible for you all to do this planning so you're not alone. And that's why we built this retirement planning platform to give you this information at your fingertips. Fingertips. I've heard consumer checkbook is a good place to compare plans. How do I access that? I'm not quite sure. I would just search that on the web. I'd search that on Google and see if consumer checkbook pops up. I'm not familiar with them, unfortunately. Do I have a summary of FEHB changes for 2026? We saw some of that on the OPM website. The headline is that premiums across the board are going up about 12%. That's the main change that we've seen. Yeah, it's one that most people care about anyway, too. It's the price. Yes. Summary should be on benefits. Thank you, Kirk. Can I review old seminars you've done? Yes, they're all on our YouTube channel. And I think there's like several dozen. We've been doing these for a long time. You notice our presentations have started to get a lot better. I hope the deck and um, the slide deck came through way clearer. We've been putting a lot of resources into making these things way prettier. Um, so our old ones aren't as pretty as our new ones, and we're always trying to make it really clear and easy because I know that this information is complicated, and a good presentation always helps. All right. Well, with that, I'm going to go ahead and let you all go. As always, it's a pleasure. Reminder: we won't see you next week because we're traveling as a team, but we'll see you I don't know. The following week is Thanksgiving week. I don't know if people are going to show up on a Wednesday for Thanksgiving week. We'll see. We'll see about that one. Um, but if there's anything you need from us, you can always reach out to us on goparco.com. We're here to help. And if you ever, like, for those of you who want to, make sure you go ahead and set your appointments right through our platform. So, everybody have a great night, and we will see you all soon. Be well.